ஹாய் கைஸ், வெல்கம் டு நர்சிங் ஜெல்ஃபிஷ். இப்போ வந்து நம்மளுடைய எக்ஸாம் பேட்டர்ன் வந்து 1 மார்க் கொஸ்டின்ஸ் ரிலேட்டடாக இருக்கிறனால நிறைய ஸ்டூடெண்ட்ஸ் வந்து கொஸ்டின் கேட்குறாங்க. ஸோ அதனால் வந்து பிளாசண்டா ப்ரீவியா வந்து இம்பார்ட்டன்ட் சாப்டர்ஸ் நிறைய பேர் கேட்டிருந்தீங்க. ஸோ அதனால தான் இந்த வீடியோவை மெயினாக வந்து கிரியேட் பண்ணியிருக்கேன். ஓகே, லெட்ஸ் see the questions. Placenta previa is defined as option A, placenta attached to the uterine fundus. Option B, placenta implanted in the lower uterine segment. Option C, premature separation of placenta. Option D, retained placenta after delivery. So actually what is the correct answer here? Placenta previa என்ன அப்படின்னு சொல்லியிருக்காங்க. என்ன ஆக்சுவலாக placenta previa அப்படின்னு சொல்கிறது, placenta was எங்கே இருக்கும், implanted in the lower uterine segment. So that is why option B in the correct answer. Second question, the most common symptom of placenta previa is option A, severe abdominal pain. Option B, fever. Option C, painless vaginal bleeding. Option D, foul smelling discharge. So what is the correct answer அப்படின்னு பார்த்தீங்கன்னா நம்மளுக்கு என்ன இருக்கும் ஆக்சுவலாக பெயின்லெஸ் வெஜினல் ப்ளீடிங் தான் மெயினாக வந்து பிளாசண்டா ப்ரிவியாவில் இருக்கும். ஸோ தட் இஸ் வை ஆப்ஷன் சி வில் பி த கரெக்ட் ஆன்சர். சப்போஸ் உங்கள் யாருக்காவது நோட்ஸ் வேணும் இல்லை ரிசர்ச் ரிலேட்டட் டவுட் இருக்குது, ஏதாவது பர்டிகுலர் வந்து பிடிஎஃப் ஏதாவது வேணும் அப்படின்னா நீ கேன் கான்டாக்ட் அஸ். ஓகே, தேர்ட் கொஸ்டின், வெஜினல் ப்ளீடிங் இஸ் பிளாசண்டா ப்ரிவியஸ் யூஷுவலி. ஆப்ஷன் ஏ, பெயின்ஃபுல் அண்ட் டார்க். ஆப்ஷன் பி, பெயின்லெஸ் அண்ட் பிரைட் ரெட். Option C, association with contraction. Option D, mixed with clots and tissue. So what will be the correct answer here? Can you check it that? என்ன இருக்குது, யூஸ்வலாகவே வந்து பிளாசண்டா ப்ரிவியா அப்படின்னா பெயின்லெஸ் ப்ளீடிங் இருக்கும். அப்படின்னா என்ன அர்த்தம் இங்கே? ஸோ ஆப்ஷன் பி, பெயின்லெஸ் அண்ட் பிரைட் ரெட் கலர் ப்ளீடிங் இருக்கும். ஸோ அதுதான் வந்து கரெக்ட் ஆன்சர். நெக்ஸ்ட் கொஸ்டின், placenta previa is most commonly diagnosed by option A, CT scan. Option B, abdominal palpation. Option C, ultrasound. Option D, MRI. So what could be the correct answer? நம்ம எப்படி வந்து கண்டுபிடிக்கலாம் அப்படின்னு பார்த்தீங்கன்னா மெயினாக என்ன, அல்ட்ராசவுண்ட் மூலமாக மட்டும்தான் நம்மளால் கண்டுபிடிக்க முடியும். ஸோ தட் இஸ் வை ஆப்ஷன் சி வில் பி த கரெக்ட் ஆன்சர். நெக்ஸ்ட் கொஸ்டின், digital vaginal examination is suspected placenta previa is option A, recommended. Option B, mandatory. Option C, contraindicated. Option D, safe after 20 weeks it is. What is the correct answer here? It is contraindicated for the placenta previa. So that is why option C will be the correct answer. Next question, a major risk factor for placenta previa is option A, primigravida. Option B, previous cesarean section. Option C, young maternal age. Option D, low BMI it is. So what could be the correct answer here? Option B, previous cesarean section, that will be the correct answer. Placenta previa is classified into how many types it is? Option A, 2 types. Option B, 3. Option C, 4. Option D, 5 types. So what could be the correct answer here? So totally how many it is? The types are 4 it is. So that is why option C will be the correct answer. In type of fourth placenta previa, that is grade 4 it is, the placenta is where it will be there. Option A is an upper segment. Option B reaches lower segment but does not cover os. Option C, partially cover internal os. Option D, completely covers internal os it is. So what was the correct answer here? Completely cover the internal os. So that is why it is a 4th grade. Option D will be the correct answer. Next question, the safest mode of delivery in major placenta previa is option A, normal vaginal delivery. Option B, forceps delivery. Option C, cesarean section. Option D, vacuum extraction. So what you have to do for this? If the person is having placenta previa, so what you have to do for it is, we should not do the, which one it is, normal vaginal delivery it is. We have to go for only the cesarean delivery. So that is why option C will be the correct answer. Next question, the bleeding in placenta previa occurs because of option A, placental infection. Option B, placental abruption. Option C, stretching of lower uterine segment. Option D, trauma it is. So what could be the correct answer here? Usually bleeding in placenta previa occurs because of what is that? Option C, stretching of lower uterine segment. When the lower uterine segment was is going to be stretched, then only you will getting placenta previa. So that is why option C will be the correct answer. In which trimester is placenta previa usually diagnosed? Option A, first. Option B, second. Option C, third. Option D, postpartum. When you will diagnose the placenta previa, it is mostly in the 3rd trimester. So that is why in the option C will be the correct answer. Next question, Fetal presentation commonly seen in placenta previa. How it is? Option A cephalic, option B breech, option C transverse lie, option D both, B and C it is. So what could be the correct answer here? Usually how it was there? It's there in breech and also transverse lie. So that is why option D will be the correct answer. Next question. Placenta previa is associated with increased risk of option A preterm birth, option B hypertension, option C diabetes, option D polyhydramnios. So what is the correct answer here? Yeah, answer A preterm birth will be the correct answer. Next question. Initial management of a stable patient with minor placenta previa includes option A immediate cesarean, option B bed rest and observation, option C induction of labor, option D forceful vaginal examination. What should do for if the person is having placenta previa? We have to advise for bed rest it is. So that is why option B bed rest and observation will be the correct answer. Next question. The bleeding in placenta previa is maternal in origin because option A it comes from fetal vessels, option B it originates from uterine tissue, option D it is from umbilical cord, option D it is from cervix it is. What is the correct answer here? Yeah, it is originate from the uterine sinus it is. So that is why option B will be the correct answer. Next question. Which of the following is not a risk factor? Option A multiparity, option B previous uterine surgery, option C smoking, option D low parity. So what is the correct answer here? Yeah, low parity will be the correct answer because it's not a risk factor. Next question. Placenta previa is more common in option A twin pregnancy, option B first pregnancy, option C teenage pregnancy, option D underweight of mothers it is. So according to this, what is the correct answer here? Twin pregnancy, because in the twin pregnancy what will happen? The weight is more, so automatically lower uterine segment is going to be enlarged more it is and going to be pulling the weight and leads to placenta previa. That is why option A will be the correct answer. Next question. A key difference between placenta previa and placental absorption is option A bleeding color, option B presence of pain, option C maternal age, option D hemoglobin level it is. So what could be the correct answer here? Yeah, what is that it is? Difference between placenta previa and abortion of placenta, that is presence of pain it is. So that is why option B will be the correct answer. I think you have understand all the questions. If you want more questions or any other topic it is, you can approach me. Okay, next question. In placenta previa, the uterus on palpation is usually option A tender and rigid, option B soft and relaxed, option C board like abdomen, option D it is hypertonic. So what could be the correct answer here? How the placenta previa was there it is? Yeah, how is the correct answer here? Soft and relaxed will be there. So that is why option B will be the correct answer. Next question. The most serious maternal complication is option A infection, option B postpartum hemorrhage, option C hyperemesis, option D eclampsia. So what is the correct answer here? Usually what is the main complication it is? That is postpartum hemorrhage. PPH will be the correct answer. So that is why option B will be the correct answer here. Next question. Placenta previa is confirmed best by it is option A transvaginal ultrasound, option B X-ray, option C internal exam, option D CT scan. How you will diagnose that? It is very easily placenta previa. It is mainly with the help of the ultrasound. So that is also TVS it is transvaginal ultrasound. Option A will be the correct answer. Next question. A woman at 34 weeks with painless bleeding should be suspected of option A abruption, option B placenta previa, option C uterine rupture, option D ectopic pregnancy. What could be the correct answer here? Yeah, option B placenta previa will be the correct answer. Next question. In minor placenta previa, vaginal delivery may be allowed if option A heavy bleeding, option B fetal distress, option C placenta not covering os, option D previous C-section. So what could be the correct answer here? Yeah, option C placenta not covering os. That is option C will be the correct answer. Next question. The fetal complication most associated is option A macrosomia, option B prematurity, option C neural tube defectus, option D jaundice. So what is the correct answer here? Yeah, mainly it was happening prematurity. So that is why option B will be the correct answer. Next question. The first episode of bleeding usually occurs in option A, early first trimester, option B, mid second trimester, option C, late second or third trimester, option D, postpartum it is. So what is the correct answer here? When the usually it is bleeding was happen it is, that is in the late second or third trimester. That is why option C will be the correct answer. Next question. In placenta previa, abdominal pain is usually how it was? Option A, severe. Option B, mid. Option C, absent. Option D, cramping. How it was there? It is, yeah, how it is? Absent will be there. So that is why option C will be the correct answer. Move on to next question. Women with placenta previa should avoid, what should be avoid? Option A, iron supplement. Option B, sexual intercourse. Option C, antenatal visit. Option D, ultrasound. What you have to avoid it is mainly sexual intercourse it is. That is why option B will be the correct answer. Next question. The term low-lying placenta refers to option A, placenta covering os. Option B, placenta in fundus. Option C, placenta near but not covering os. Option D, it is detached placenta it is. What could be the correct answer usually? Low-lying placenta means placenta near but not covering the os. That will be the correct answer. That is why it is option C will be the correct answer here. Next question. Placenta previa increases a risk of option A, placenta accreta, option B, oligohydramnios, option C, hyperemesis, option D, fibroiditis. What is the correct answer here? Yeah, option A, placenta accreta will be the correct answer. I think this video is useful for you. Please don't forget to like and subscribe our channel. Okay, fine. Next question. The priority nursing action is active bleeding is, what you have to do for that it is. Option A, perform vaginal examination. Option B, monitor vitals and prepare IV access. Option C, encourage ambulation, that means walking. Option D, delay reporting it is. What you have to do for that? If the mother is having placenta previa and she is having bleeding, what you have to tell the persons it is? We have to advise that as a nurse, we should do some of the things. What is that? First, we have to tell the patient to go for bed rest. Got it? It is there, it is not there. Second, you should not do vaginal examination. Definitely, you should not do vaginal examinations. And third, what is that? It is monitor vitals and prepare for IV access. So that is a B answer will be the correct answer. It is. Shall I do the patient to ambulate? பிளாசண்டா ப்ரீவியா இருக்குது அப்படின்ற பேஷண்ட்டை வந்து நம்ம ஆம்புலேட் பண்ண சொல்லலாமா? கண்டிப்பாக கூடாது. ஸோ யூ ஹவ் டு டெல் த பேஷண்ட் டு டேக் ஒன்லி பெட் ரெஸ்ட் இட் இஸ். ஸோ தட் யூ ஹவ் டு அட்வைஸ் த பேஷண்ட். தட் இஸ் வை ஆப்ஷன் பி வில் பி த கரெக்ட் ஆன்சர். ஐ திங்க் திஸ் வீடியோ இஸ் யூஸ்ஃபுல் ஃபார் யூ. இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்தா மறக்காமல் லைக் பண்ணுங்கள், சப்ஸ்கிரைப் பண்ணுங்கள். இது ஜெல்ஃபிஷ் மீனா. தேங்க்யூ ஃபார் வாட்சிங். இதை தவிர வேறு ஏதாவது உங்களுக்கு வீடியோஸ் வேணும், நோட்ஸ் வேணும் அப்படின்னா யூ கேன் காண்டாக்ட் அஸ். நோ ப்ராப்ளம் இட் இஸ். ஐ வில் கைட் யூ, ஹெல்ப் யூ ஃபார் த எக்ஸாமினேஷன்ஸ் ஆல்சோ. ஓகே ஃபைன். தேங்க்யூ ஃபார் வாட்சிங்.